It is our monthly checkup for February. We have Dr. Sarah Collins-McGowan back with us from URMC. Spoke to you right at the turn of the year. That was when we were getting into flu cases, really just going crazy. At least that's kind of eased up a little bit. So glad to have that. Yes, for sure. Some of the topics to go over, and this is in some news. Recently, it's about social media and young people, teens, and below that. Australia took some more drastic steps and had a law kick in about essentially banning it for young people, or adding, make sure there's consent. Parents can sign on before anyone could use an app. Spain just recently took a similar measure. Some states here in the U.S. have done it to some degree. Just in the broad picture, what are the benefits of doing something with a crackdown on that?
It's interesting to watch this happen in some other countries, and sort of I think we'll learn what the result is from them. It's pretty unclear at this point. I think when we talk about social media, obviously that conversation is a little bit nuanced. I mean, there are definitely good parts to it. There's connection for people around family, friends, interest groups, support, things like that. But there's also, of course, the concern about content that might be negative, whether it's negative body image or violence or false information, and can sometimes be used as a platform for bullying or abuse as well. So that's really the piece of social media that I think people are concerned about, and trying to impact with these bans, especially for kids who are still really developing. Their brains are still developing, their sense of self is still developing. They maybe don't have as much kind of critical thinking skills to think about how these the content that they're seeing is impacting the way that they're thinking about themselves, or the way that they might be thinking about others. And so I think these bans are a way to get at trying to put some guardrails around that for kids, and see if we can help them develop healthier relationships in that digital world.
What's interesting is these will, in effect, because they're covering countries, will be large-scale studies, so to speak, versus you're taking a pool of 300 or 500 and you're putting them through a clinical research. This is outright for a country, so a year, 2 years, we'll be able to see some results. What's kind of the impact of kids having these conversations online or through the apps all the time versus in a classroom, at a park, at a ball field, something like that, where they're hanging around with some people? And yes, I know bullying happens in person and online, but still the person-to-person communication.
Yeah, I think, we've all kind of experienced the difference in communicating with people through screens versus in person, especially since COVID. And I think everybody would agree there's certainly a difference there in just some of the social cues, the nuance that you're able to pick up, the way somebody's responding to you. So those are things that we obviously want children to, learn and develop and, understand about conversation. I think also, the social media platforms, they're really designed to be addictive, right? They want to keep you on the screen as long as possible. And so at the very least, that's also a time suck, right? The more time you're spending on your screen, the less time you're spending in real life, with people face to face, the less time you're spending sleeping, the less time you're spending studying, all of those kinds of things. So even at just a kind of time, standpoint, that's something that's worrisome, for kids.
Something else that in recent weeks, vaccines and changing recommendations for whom, for when, or just not. So what are some of the big points there that we've seen?
Yeah, so the big change that happened is the CDC updated their vaccine guidelines for children and adolescents. And what they mainly did, the main change that happened is that they kind of took away universal recommendation for vaccines, not all vaccines, for some of the vaccines at certain ages, and moved to more of a risk-based or a clinical shared decision-making model. And so what that means is instead of just, universally recommending that kids at this age all get this vaccine, that they're recommending that, parents have individual conversations with their healthcare provider about each of these vaccines and decide whether, they're going to do those for their children. And that doesn't necessarily sound like a huge change on the face of it, but I think, the vaccine schedules are well studied and are really evidence-based as a good public health tool. They're meant to keep our population as a whole healthy, and to prevent illness before it starts, to prevent outbreaks, to keep kids healthy and doing the things that they want to be doing. So there's a lot of concern in the medical community that this kind of change means that there are going to be more children who are at risk for some of these illnesses, where they wouldn't have before with the universal recommendation.
And it can be confusing too, because it used to be, I'm a parent, you go in, there's this chart, it's a red column, yellow column, green column of 6 months we're doing this, 12 months, 18 months, and now it's kind of well, is this shot, are we supposed to be doing it? Or are we supposed to wait? Or is my child high risk for something? Or even for uh, people getting vaccinated, if they're, older, do I have a qualifying condition of where I should get something? And now it's kind of just like, kind of spread out, it feels like. Yeah.
Yeah, yeah. I think the good news on that is that so last week the American Academy of Pediatrics, or the AAP, released their updated vaccine schedule, and they do this every year. But this year is the first year in quite a long time where their recommendations have differed from the CDC schedule, and so they have stayed with the evidence-based guidelines of continuing those universal vaccine recommendations. And so since they put those out, a number of major medical organizations have endorsed that, including the American Medical Association, the American Academy of Family Physicians, and importantly here in New York State, the New York State Department of Health has also endorsed the AAP vaccine schedule. So that's the guidance that we're still going by here in New York. There's a number of other states that have done the same. And so there's not going to be any changes to, required vaccines for school. There's not going to be any changes to vaccine coverage or access from insurance in this state. It is state by state, but in New York State, those things are going to stay the same. So that's a big, I think, relief for those of us living here. We're certainly getting lots of questions from parents about, am I still going to have access to vaccines? Is my kid, my younger kid, still going to be able to get the same things that my older child got? And so at this point, we can really say, yes, we're confident about that.
From guidelines about shots to food and what we're having. So what's new with dietary guidelines?
Yeah, so there were some new dietary guidelines put out too. And, I think maybe one of the most jarring things visually was this idea of the upside down food pyramid, which I think really, stood out to people. But actually, if you look into the guidelines, if you dive into them, there's not a whole lot of change, and they're pretty common sense. So, an emphasis on, whole grains and dairy and, vegetables and fruits, that's all still in there. And, things like avoiding highly processed foods, foods that don't have a lot of, nutrients in them, avoiding caffeinated beverages and beverages with added sugar in them, especially for kids and teens. That's all still part of the guidelines. And I think, two of the things that maybe stood out to me were this upside down food pyramid, which makes you think, am I supposed to eat a lot more fat now? Is that what's changing? But that's not really in the guidelines at all. In fact, the level at which, they recommend having less than 10% of your diet be from saturated fat, that's still there. That hasn't changed. It's just a little bit of a visual representation that's different. And then protein, I think, is the other thing that changed in there. There's some increased recommendations for the amount of protein that is recommended, and that's something that the two things I would say about that. One, I think sometimes people think that protein, if you eat protein, it's turning directly into muscle. That's a healthier way to get energy, but it's energy just like anything else. And so if you have excess, energy, your body stores that as fat, whether it's protein, whether it's carbs, whatever it is that you're intaking it. And there can be some, long-term health impacts from really high levels of protein. So that's something where if you're not sure about your intake, I would definitely, encourage people to talk to their individual medical provider and go over, their own health and figure out what the right guidelines for them are.
I was going to ask you about that because just the protein craze is just insane now. And everyone thinks, I need to have that extra shake. Is it 1 scoop or 2 scoops? And then I, heard a conversation with some doctors, some story online. They're like, if you're eating healthy, you're having good meals, like you yourself, you're probably getting the protein that you need. You don't need to have that added shake in the morning or whatever it is. Yeah.
Yep, that's right. There's always crazes, but in general, I mean, the guidance that always stays pretty consistent is, everything in moderation and a good variety of foods. The protein craze is something we're certainly keeping an eye on, especially for kids and adolescents. Consuming a lot of protein, especially kids who are into athletics, are interested in, should I be getting more of this? And some of those kinds of supplements and high levels of protein can have some impacts on the kidneys, and we want to keep kids, healthy there. So we try to discourage that and just, eat a good variety of foods in your diet, and you'll be fine.
Finally, this month, it's Children's Dental Health Month. And I've got a 3-year-old, almost 6-year-old. And I mean, even now I'm in my 30s, they're saying floss more, do this. And that's what I'm trying to work with, like on my kids. It's like flossing more, making sure we're getting all around the teeth. And they tell you it's one of the most important things you can do, but it can always be, it feels like a struggle too, because the kids might not want to, and we're trying to twice a day doing it all. What would you tell parents about kids and their teeth coming up?
Yeah, I've been there too. And it is definitely a lot of work, especially if your child is not the most cooperative. But it is important. You know, a lot of times we get questions about why should I care about baby teeth? They're just going to fall out. You know, we're going to have adult teeth. Is it really that important to take good care of them? And it is. You know, baby teeth do serve a function. They're there to, you know, allow kids to chew. They're there to help with speech development. If you think about when you're talking, you know, the shape of your mouth and some of the sounds that you make where you're putting your tongue against your teeth. So it's important for that. And holds place for the permanent teeth as well. So you do want to start young. You do want to get kids in the good habit of, you know, taking care of their teeth. It is going to be important, you know, when they're older, but it is not always easy.
No, it's not. And at our last checkup, the dentist was like, here it's good. It's always, you know, the bottom front two right in the middle. They're going to be coming. And I'm like, how soon? And they're like, maybe a month. And I was like, a month? And then I said, and they said, oh yeah, she can, go ahead, start wiggling it. They'll start doing it. And now my daughter's just like, Dad, I think it's loose. And I'm like, you don't have to pull on it every single day. Have that. I'm sure you went through that too. Yes,
absolutely.
Getting there. Listen, thanks for sharing that for this month on our monthly checkup. And we'll be revisiting this again. Thank you.
My pleasure. Nice to see you.
Get the Rochester First streaming app today for everything you love from News 8 On Demand, plus exclusive shows you won't see anywhere else. Search ROC and download for free on Roku, Amazon Fire, and Apple TV.